Good afternoon, everyone. Good afternoon, everyone. Thank you. It's post-lunch, so I want to make sure we're all paying attention because we're here for a very important discussion. I am Andrew Sollinger. I'm the CEO and publisher of Foreign Policy Magazine, and I'm very honored to be here and moderating an important conversation hosted by the Pandemic Fund. I want to welcome all of you who are in the room, as well as everyone who is live streaming online right now. We are broadcasting this globally. The theme of today's discussion, From Fragmentation to Coherence, Partnering for Pandemic Resilience, Country Leadership at the Core of the Pandemic Fund's Vision for a Safer World, says a lot. It's timely. It says a lot, but it's important because that's exactly what we're going to talk about. We're going to explore how we can move forward towards more coherent country-led approaches to partnership and sustained investment in pandemic preparedness. So we have a great program today filled with very important health ministers and officials who are going to share with us their insights and how we're working together. We're going to hear from leaders across government, international institutions, civil society, the private sector, and we're going to talk about how the Pandemic Fund is catalyzing these efforts to support country-driven investments and helping to make us all safer, which is really what's critically important. So to get us started, I wanted to introduce a person who's at the heart of that mission, Priya Basu, Executive Head of the Pandemic Fund. And I would just tell you that if you want to learn more, and you probably know more about Priya and the good work of the Pandemic Fund, but if you want to learn more, you should go to foreignpolicy.com and look up a Q&A that we're running currently right now with Priya on all this good work. And it's very informative and will tell you all about what the Pandemic Fund does and Priya's views on that. So I thank you, Priya, for joining us and convening all of us together. Please, the floor is yours.
Thank you very much, Andrew. Excellencies, honorable ministers, distinguished guests, colleagues and friends. On behalf of the Pandemic Fund, it's my pleasure to welcome you to this important event at the World Health Summit. We're gathered here today at a pivotal moment for global health, one that calls for renewed commitment, fresh thinking, and bold collaboration. 3 years ago, on the heels of the COVID pandemic, the international community came together to establish the Pandemic Fund. We were formally launched at the G20 finance ministers and health ministers meeting in Bali, Indonesia. And we're very pleased to have Minister Budi here with us. The Pandemic Fund is the first and only multilateral fund dedicated to helping low and middle income countries bolster their capacity to rapidly detect infectious disease outbreaks and prevent them from spreading. Our model is country-led, country-owned, country-driven. It fosters coordination and collaboration across governments, international organizations, civil society, philanthropy, and the private sector, and it's designed to catalyze additional international and domestic resources for countries. We move forward quickly to fill critical investment gaps in pandemic preparedness and have already built an investment portfolio of $7 billion US dollars, spanning 75 countries across 6 geographic regions. We take a disease-agnostic approach to our investments, as we know that we don't know what the next pathogen that could cause a pandemic is. As we will hear today, the Pandemic Fund-supported projects have already begun to make a difference through investments in critical areas like surveillance, testing, laboratories, and the health workforce. Our vision is clear: a safer, more resilient, and stronger world, anchored in national and regional priorities, and powered by effective partnerships and cross-sectoral and cross-country collaboration. As we face mounting threats to health security, let us seize this opportunity to move from fragmentation to coherence, and to work together for a future where every country is equipped to prevent and respond to outbreaks. I'm very much looking forward to a great discussion today. I see many familiar faces in the audience, many friends, partners, supporters. Thank you all for joining us. And let me also acknowledge the Pandemic Fund team that's here today. Mikhail, who is our Deputy Executive Head, Jingo and Paige Snyder sitting there, and Anita, who's not with us here in the room today, but all four of them have been instrumental in getting this event together. So with that, thank you again. Thank you for being here. Looking forward to a great discussion, and let me hand it back to Andrew.
Thank you, Priya. That was very insightful, and congrats to you and your team, of course. So now I'd like to kick off with our distinguished panel. I'm going to call them up one by one, and if they could take a seat starting at the far end and one by one and move over in this direction, that would be wonderful. His Excellency Budi Gunadi Sadikin, Health Minister of Indonesia. Minister. Very well done. His Excellency Rakan Nasser El-Din, Minister of Public Health of Lebanon. His Excellency Austin Denby, Minister of Health of Sierra Leone. Dr. Lisa Indar, Executive Director of the Caribbean Public Health Agency, CARPHA. Kinz ul Iman, CEO of the Dopasi Foundation. Please join us, Pakistan. And my good friend, Dr. Jean Kaseya, Director General of the Africa CDC. What a lineup. This is quite a row of speakers. A warm welcome to you all. Thanks for joining us. I'm going to stay up here and out of the fray. I am not the expert. I am but the guide for this discussion. So we have questions for each of you in a short period of time. So we want to remain concise and work our way through. We're going to discuss pandemic fund supported projects and how they're already helping with timely detection and containment of outbreaks. And so let's just dive right into that. And Minister Sadikin, I will start with you if that's okay. The Pandemic Fund was established and launched under Indonesia's G20 presidency in 2022, and Indonesia was amongst the first countries to financially support the Pandemic Fund as well. Why is the fund a critical part of global health architecture, and what sets it apart from other financing mechanisms?
Yes, I'm a banker for 30 years, so I don't have any medical background. So as a banker, we have seen many global financial crises, and we see how to great global financial institutions like the IMF and World Bank save many global financial crises. When I joined the health sector, I didn't see the same time when we have the global health crises. We didn't have the global health institution as strong as those two institutions that can help us. So that's why the establishment of the Pandemic Fund is for that purpose. And to share with you, pandemic preparedness and prevention, the Pandemic Fund has done a great job in facilitating, catalyzing and supporting the preparedness and also the prevention. My worry, which is I keep saying this as one of the founder and the oldest health minister that stay since the establishment of Pandemic Fund, we need to be prepared for the response part of the PPPR. The peacetime, we are well prepared, but when the wartime happens, we have to make sure that billions of US dollars can be disbursed in not only months, but also weeks, ideally days. Like the IMF can do it when a country had difficulties in crisis. This is something that I need the Pandemic Fund in the future to start working on it, because I have seen there are a lot of risks that we need to cover at the first layer before the development banks can coming in and support the financing when the real pandemic happens. So I wish Pandemic Fund that has grown very well, success in the future, and don't forget, as one of the co-founder, the response side, please, the wartime fund.
That's great. Can I just ask a quick follow-up question? Since you're a banker and have a finance background, we're in a perilous state right now in financing and development finance. It's fantastic to have mechanisms like the pandemic fund filling that gap. What other mechanisms do you think will be out there to help, and how critical will the pandemic fund be in that effort?
My first advice: the money is there. How we access the money, it is something all the health ministers need to understand. So the first advice, every health ministers in every country, you need to create a health financing roadmap or pathways. You cannot live forever with grants. It's like our children. We cannot give our money forever to our children. Our children need to be independent. So clear health financing pathway from 100% grant, 50% grant plus concession loan, and etc. Second, if you lost money, that is billions or 10 billions. I sit at the board of Gavi. I did the replenishment. My deputy sat at the board of Global Fund. All of them have problem in terms of financing replenishment. But I tell them, you're looking for what? 10 billion, 15 billion, 16 billion? Yeah, because the largest country pull out. There is one entity that can disburse hundreds of billions of US dollars every year. And the ladies are sitting here. This is the largest bank in the world. They're called the World Bank. The World Bank disburses more than 100 billion US dollars every year. Unfortunately, only a small amount come to health sector. It is money. The money comes with a little bit interest, not free money, but there is money. So for us, I don't have any problem because we can have access to the World Bank. So my advice to Global Fund, just to be creative, the money is there, just to write a good proposal, discuss with the team that have money, and you can get it.
Love the banker perspective. Thank you, Minister. We'll come back to you. That was good. Minister Nasruddin, so Lebanon's pandemic fund supported project, it cuts across sectors, brings together ministries of health, agriculture, finance, which is actually one of the key focuses of the pandemic fund, alongside several implementing entities, and so the multi-sectoral approaches and multi-partner coordination is important. How is this approach benefiting Lebanon's capacity to prevent and respond to health threats through the One Health initiative?
Well, thank you, Andrew. From a vascular surgeon perspective and never a banker, I'll approach this in a different way. Well, in Lebanon, one of the main problems that we face is basically fragmentation. And from fragmentation to coherence, this is the main ultimate goal that we were benefiting and we're looking for from the pandemic fund. As you said and mentioned, we have an interministerial now coordination better with this funding, including the Ministry of Health, Finance, and Agriculture, in addition to international organizations and local organizations. This will help us formulate the plans based on need and in better coordination. Now, for example, after all the problems that we have faced over the crisis that we encountered over the past 6 years, better reforms are being structured by the new government, and one of these reforms is basically this interministerial communication. With this cooperation and these plans, we are now able to set up rules for the Central Public Health Lab, for example, that we've never made before. In addition to that, we can plan our systems in a better way. For example, we have porous borders, we have poorly controlled veterinary system, and poor coordination among the ministers. We will benefit and borrow the experience of bankers from the Ministry of Finance. We'll borrow the experience of agriculture from the Ministry of Agriculture, FAO, the WHO, the World Bank, in addition to Red Cross. this thing is a role model for us in a country that has been challenged a lot. And this is how we are benefiting from this opportunity. We also are planning to, we have launched the steering committee, including all ministries, with One Health approach, with the Ministry of Health at the head of this committee. And at the same time, we have launched the execution or executive board that is more technical to implement the plans that the steering committee can publish and produce.
Great. And I need to ask, obviously, big news coming out of the Mideast today. There's been such flux in Lebanon. How are you feeling about, this is great news that you're sharing right now. How are you feeling about the progress that you're making in light of the tremendous challenges you're facing in Lebanon?
So, well, as you know, each hope that can be sent to the Middle East is of high appreciation. We hope that this will be reflected into our country in a peaceful manner, and this will definitely improve the productivity, not only at the health sector, but also towards the reforms and towards the productivity of the economical status that we were challenged by. This will be definitely also be reflected not only into into our need now, but also into the future of the generations in that country. So we look forward in a positive manner, in a positive attitude, and we wish all the countries the best peaceful time that we need, really.
Inshallah.
Inshallah.
Minister Denby, thank you so much for joining us. I'd be very grateful to hear your understanding of and how you're working with the Pandemic Fund, if you could share some of your insights and your experience in Sierra Leone.
Well, thank you very much. I've heard the minister from Indonesia speak a few times. One day when I get older, I'll be just like him and have the confidence that you could raise the resources. Sierra Leone, you know, we had a major Ebola outbreak in 2014, 2015, and that was the largest outbreak that anybody had ever seen in the world. And it brought to focus the IHR, that was just a piece of paper that people didn't pay attention to. But with the outbreak, it really woke us all up. You had 14,000 infections of Ebola in Sierra Leone and 4,000 deaths. We told ourselves that never again. Never again. We were caught unprepared for this. And I think the lessons for us is to ensure that this doesn't happen again. And what that has meant is that we have found an institutional home for all of our preparedness and response capabilities. In 2022, we established a new National Public Health Agency. The National Public Health Agency is not just an ivory tower. It's embedded in our primary health care, because we believe that the speed of detection and response is very critical to the nation's ability to manage these outbreaks. So what we have are field epidemiologists that are embedded in the primary healthcare system with early warning systems and triggers to allow speedy, rapid response and being able to contain the outbreak when you have a few cases. What the fund has been able to do for us to help catalyze the process, and we have received about $20 million from the fund, which brought us some of the implementing partners, WHO, World Bank, and IFO, and to come together and work as one unit, looking at institutionalizing our preparedness and response, looking at strengthening our laboratory systems, looking at strengthening our data systems and our communications capabilities. I think with all of these, we're in a much better place today than we were in 2014 and 2015. And I think what I want to assure this public is that with these additional resources, we're not only looking at setting up systems for early detection and response, we're also looking at how do you bring everybody together under one roof, under one coordination mechanism, under one reporting, and ensure we could share the attributions around it, because at the end of the day, we want to detect early and contain every outbreak. Well, thank you.
Well said. I think actually you do speak with as much, if not more, confidence than Minister Siddiqui. Maybe not about financing, but nonetheless. I wanted to ask a quick follow-up. Since the Ebola experience, and clearly that has catalyzed this will, and probably, would you say it has helped with that coordination? Of course, you can't speak for other countries, but almost gives Sierra Leone a hard advantage. I mean, then, of course, the COVID-19 pandemic on top of that, I would have thought that would create unity around the cause. Do you find it, again, not wasting a good crisis, helpful?
Well, for the Ebola outbreak, we had 2 years. So the first year was trying to figure things out, and the second year was the response. But we learned from that because, again, up till today, nobody really believes in some of the data that's coming out of Sierra Leone for the COVID response. But whilst everybody was trying to bring the public along, Sierra Leone was way ahead because everybody knew what hand hygiene is. Everybody knew what social distancing is. Everybody knew what reporting is. So we were able to record one of the lowest infection rates as seen by not only the limited hospitalization, but also one of the lowest mortality rates as a result of COVID. So there are lots of lessons learned, and I think what the Pandemic Fund is helping us do is consolidate those gains.
Right.
And actually make it much more institutionalized. Like I said, it's not just a central location, but every district, every chiefdom, every lab, every PHU has the ability to be able to look at the data and see if there's any unusual activity and alert the central for rapid response.
Thank you very much, and it's great to learn from your lessons here today, so thank you for sharing from Sierra Leone's lessons. Dr. Indar, it would be great to bring you in right now. Would love to ask you about, CARFA was the first to roll out a pandemic fund-supported project, so what types of activities have you invested through the project? What are some of the early results emerging? And how is this making a difference today?
Thank you. And first, let me thank Pandemic Fund and Dr. Priya Basu. This fund has transformed the way the Caribbean is responding to public health emergency. And like my colleague just said, it has provided necessary impetus as well as a catalytic effect to move from normal surveillance to real-time surveillance, and that's the whole idea between pandemic preparedness and response, being able to respond in real time. And why is that so important for the Caribbean? So CARFA is the regional public health agency, and we are privileged to still be the only regional entity recipient of the pandemic fund, but we serve 26 member states. And unlike some of the countries here, we are small and smaller, very, very tiny, 5,000 persons and 1.2 million persons. But we are still 26 different countries, and we are interconnected, highly porous borders, and high dependence on tourism and high vulnerability to disasters, and so on. So an outbreak, for instance, in one country is going to be an outbreak in the region. So we needed to build capacity, not just in one country, but we needed to build regional capacity to be able to rapidly respond across borders in a quick way. So the Pandemic Fund provided that impetus. The fund, for instance, I'm happy to say, we have about 500 activities in that fund. And, in a matter of about a year and a quarter, we have been able to have progress in over 400. And we have completed 153 of those at a burn rate of 25%. But this fund has allowed us to make progress in all 4 areas: early warning and response, building lab capacity for early warning and response, developing your workforce capacity, and partnerships. So some of the key achievements, the big one is the development of a real-time early warning systems. CARFA has 15 different surveillance systems: vector-borne, foodborne, travelers' health, and so on. What this fund allowed is to take those surveillance systems, add an early warning component to it. You can get it on your phone, and so on, and so that you can rapidly respond. And that is so important because we are already seeing the impacts where you're seeing diseases or information being detected faster. From that stem our novel mass gathering surveillance system. That has had quite a milestone impact. We had to develop a system for mass gatherings in small settings, and we could not use the larger scale ones. So we developed one, particularly it was real-time, confidential, send alerts. And we used this during the Cricket World Cup. And while the game is happening, I always use this example. It's 10 o'clock in the night, game is happening, persons are sick in the stadium.
Oh,
they
great.
are being moved and put in an ambulance, area is being sanitized, and no one knows what's happening. That's how sensitive the system is. And it has since been used, in Carnival and in 9 countries and events, in the Energy Conference in Barbados and Junkanoo in Bahamas and so on. So that's one other system that is stemming out. From it, we have the Traveler's Health Surveillance System that provides real-time alerts. So, for instance, a cruise ship is coming. One example is just earlier this year, ship is coming in with high infectious rate, dual types of infection. Because of the system, we are able to provide data to the country before the ship arrives, so they can decide, make a better decision based on that information. We were able to launch our integrated antimicrobial surveillance program, and this is not just human data, but clinical food and animal data. And being able to launch, it also provided an impetus to get further funding from the UK HSA for that. And then there are many others, but then we created the One Health platform. This is a novel One Health platform that has integrated human, animal, and environmental data. And that's just the surveillance side. On the lab, we would have sent to 15 of our countries small biokits, which can be able to detect mpox and measles, something of pandemic potential, in 2 hours. That's very important when you're very far away. And we provided support through training and sample transport. And then CARPHA has 3 regional hubs because we have 26 countries. Through the Pandemic Fund, we have expanded testing, so countries now are able to send to these countries, to these hubs, and be able to get their data in a faster manner. And in terms of the coordination, we have then strengthened that by building workforce capacity, lab, epi, environmental health, veterinarians, into the whole One Health integrated approach, rapid response mechanisms.
Great. And I'd like to come back to you, not now, but I'd like to come back to you on that workforce initiative, because that's not discussed frequently enough. We talk a lot about financing, and that's excellent insight into surveillance, so thank you for that. We'll come back there. Thank you. Kinz-ul Iman of Dopasi Foundation. Civil society engagement in communities is integral to the work done by the Pandemic Fund. And the project, Pakistan's project, is just getting underway. From your perspective, why is civil society involvement so critical?
So just coming in for any Pandemic Fund project, not just Pakistan, civil society engagement is key. We have been talking about financing for this whole time, and we have been talking about when we are so-called in a state of peace, not in a state of just like the COVID emergency that we were in. Civil society brings in the trust. It's basically the connecting tissue between the global stakeholders, the policymakers, and the community at large. They have the reach. They can reach where MDBs cannot reach, where multilaterals cannot reach, where even the ministers cannot reach. They have the legitimacy. A person sitting in one of the rural villages of, be it Lebanon or Pakistan, will not listen to an IE coming in, but they will, if I tell them to move from someplace, or if I tell them not to get out of their houses, they will listen to the civil society, they will listen to their local communities, their local leaders. So, and then they have the space and muscle to be the voices that can actually bring up an issue. A multilateral or an IE might not, or even an implementation organization, the big implementation organizations, cannot actually voice the concerns to the government when they need to hear. There needs to be a devil's advocate out there to ensure accountability, both upside in terms of whether we're sticking to our mandates, whether we're being effective, whether we in placing all the surveillance systems we're talking about, whether we have those systems in place, and then community-led monitoring actually feeding us in from the lived experiences. Because we're talking about resilience, we're talking about preparedness. I think if we leave the community out of it or the civil society out of it, we cannot be truly resilient in any aspect. Coming in from Pakistan is kicking off its grant again, just like Caribbean mentioned or Lebanon mentioned, Pandemic Fund has supported the country a lot, and there has been super awesome movement from, for the first time, I assume all the One Health colleagues are coming together, sitting together. Ministry has formed this joint working group. There is a national steering committee, so on and so forth. So progress is being made. A lot of investment is happening into the systems, into the surveillance system. The connecting tissue of community needs further strengthening. Plans are underway. There are plans are underway for civil society engagement, and I'll be the biggest advocate, not only in my country, but in the Global South, being the Pandemic Fund Civil Society South board representative. So I will further I had a discussion actually around having civil society in all these steering committees, not only from an implementation perspective, not only from a beneficiary perspective or an implementer's perspective, but actually having a seat at the table and having a voice in the decisions that are being made for us to be truly resilient, and that is what is the need of time.
Outstanding. That's involving the civil society and the community sector is really key. You're very passionate about that. Thank you for sharing. Dr. Jean Kaseya, Africa has made significant strides in strengthening cross-border collaboration for health security. We saw this during COVID-19. We've seen it with new outbreaks. Why is regional cooperation so critical for pandemic preparedness in Africa? And how is the Pandemic Fund helping to foster this type of collaboration, if you could share?
Yeah, thank you. Let me first start with why regional collaboration is important. Look, when I started in Africa since in April 2023, the same month I called for a meeting because US colleagues, they had to bring to my attention the Mpox issue. This meeting took place in DRC. We invited 7 countries. Out of the 7 countries, only 2 were affected. 5 others were asking me, DG, why are you inviting us? I said, just come, we'll discuss, and we'll see how we can prevent this disease to cross our borders. Later, all of these countries were affected. The lesson that we learned from that, when we have shared vulnerabilities, you must have shared solutions. What are we seeing in Africa? Mostly all countries, and Minister Dembi is here, weak health system, weak surveillance system, lack of appropriate human resources, lack of accurate data, weak supply chain management, and the financing issue. But when you are dealing with that with 55 countries, you need to see how to bring all of these countries together to optimize some resources that you have. This is why the regional approach is helping us with the joint procurement mechanism. During COVID, we did it. Now, we decided to put in place the African pool procurement mechanism. We decided to have a joint digital platform. I'm glad to see my brother Adam. I think, Adam, when you will speak, talk about your experience during COVID. We managed to put in place a strong digital platform for Africa. We decided to also harmonize the National Public Institute. Minister Dembi was talking about it. We had only 6 countries in the National Public Health Institute. We learned from that to see how to disseminate this experience. You know, this is what the regional effort is doing, coordinating across this vast continent of 55 countries. Now, talking about Pandemic Fund. You know, when you are in crisis, you are looking for who do you have to call. When I declared Mpox as public health emergency of contact security in August 2024, I called prayer. I said, prayer, what can we do? Quickly, we need solutions. Don't forget, at that moment, they were telling me just, I will have 20,000 doses of vaccine. 20. They were telling me there is no money. Priya said, pandemic fund received some proposals, will fast track. The next month, we got 124 million for 10 countries. And it was a blessing. It was the first pledge that Africa received before other pledges. And pandemic fund is helping us to better operationalize our plan. Joint surveillance system, training of health workers, supporting the lab system, making sure that we create the lab network. Today we have a lab network in Africa. I think we can continue to talk about the benefits of pandemic fund. I'm here today. Andrew, I want to make it clear, as an African leader, to say, we will not accept in Africa to see pandemic fund down. We'll support the replenishment of pandemic fund and will continue to see pandemic fund strong and supporting all African countries, but also the world.
Very compelling words. Thank you, Dr. Kaseya. And great to hear these specific examples of the pandemic fund coming to help when help is needed. I have more questions for everyone, and I hate to go in exact order, but I will go back to you, Minister Sadikin, for this one. You talked about financing, and you talked about Indonesia's support for the pandemic fund. Indonesia has also been a grantee of the fund for an important project. I understand that the grant has unlocked over $227 million in co-investment from domestic resources and over $21 million in co-financing from the World Bank and other international partners. Can you tell us a little bit more about how this project is making a difference? And do I have those numbers right?
Yes, I realize that most of the pandemic happens when the pathogen from animals jump into humans, and humans' immune system doesn't recognize this pathogen, so they cannot respond, and we die. That happened with the Black Death. I heard it came from rat, the Spanish flu. I heard it can come from bird or pig, and also the COVID that I heard is come from bats. So with that logic, I learned that there is a concept called One Health, but the implementation is slightly behind. So what we are thinking is, why don't we scan all the animals that have the most potential to have pathogen jump to human? Whale is very unlikely. Man don't interact with whale, but bird, chicken, these, especially with climate change, the interactions between human and animal become more often. So why don't we scan those animals and then scan the top 10 pathogen and these animals that most likely can jump to human and start developing the diagnostic tool, the vaccine, and the therapeutic tool at the animal level rather than human. Because that is cheaper, that is faster, less expensive, no complicated clinical trials is needed. So if one of them jump, eventually, we understand this pathogen already. So that is all about. It is not only about Minister of Health, but working with the Minister of Environment, also the Minister of Animal Husbandry, to make sure we are well prepared and understand how if this pathogen jump to human.
That's a very interesting approach and sounds very unique. I don't know if this is something that Indonesia has adapted from other countries or regions that have undertaken this type of approach. But congratulations on that focus on zoonotics, and very much fits in with our One Health approach that we're talking about today. Kin Suleiman, I'd love to come back to you. That was very interesting points you made about involving communities and civil society. The Pandemic Fund's Governance Board now includes civil society. I believe that's you. You had one meeting. You'll have many more, I hope. That signals a strong commitment to inclusion. And I would like to ask from your perspective, what are the most important elements of that engagement in global health governance for civil society? And how specifically can civil society most effectively contribute to shaping the direction and future and impact of the Pandemic Fund, and more broadly to advancing PPR?
Yeah. So Pandemic Fund Board actually has two civil society seats. One is the Global North and one is the South. And as member of the board, I would start by acknowledging the Pandemic Fund actually. I've sat on multiple boards, and the difference that I see between the Pandemic Fund Board and the other boards that I sit on, from the day one, you are not your voice is not any lesser than a contributing member for sure. I co-chair the finance committee, and my colleague from the Global North co-chairs the strategy committee.
Who is your Global North co-chair?
Global North, Olia from Frontline AIDS, I suppose.
Mm-hmm.
She's the co-chair for the strategy committee. So civil society is truly embedded. So thanks to the leadership for actually ensuring that to happen. We are weaving in the values from all aspects end to end. And when it comes to sort of shaping the future, as I mentioned earlier, we want to build around the same lived experience perspective and try to have more of civil society representation and civil society acknowledgement in the downstream delivery, from the co-creation point when we start with, when we have, and we included some really nice lingo in the call for proposal that went out, to have consultations with the civil society, with the communities from the design phase and throughout to the end of this, throughout the implementation up till the grant closeout. Why it's essential is we're talking about resilience, and we're talking about this to be sustainable in the longer run. We need civil society and we need the communities to translate the priorities, to translate into local ownership and thereof true reliance in sustainability in the longer run. And for me, investment in just systems and labs is not enough. We need to invest into the communities. We need to invest into the communities, not just from a from a technical perspective. Even like I personally believe that an auntie in a village, her voice, when she goes from her house, oh, you know, so-and-so had an eye thingy, that is going to transmit at a rush speed than any other NIH system. So even from an intelligence perspective and from a surveillance perspective, you need to invest into communities and you need to invest in civil society. And Pandemic Fund is on a great start with having the right representative, right shape, and better shape than many other mechanisms have actually been aspiring to. And we see this role going forward even stronger.
That's great. Thank you for sharing that. And you're right, entities have top-level surveillance capabilities. It's almost like inhuman. Lisa, I mentioned that I would be asking you about workforce development. I hope you have been thinking about that. It is a lot of conversations that I've had here this week about pandemic preparedness have revolved around surveillance, have revolved around technology and innovation, around financing. We don't talk enough about the importance of the workforce. Maybe you could share what you've seen in CARPA in the Caribbean.
Well, if you don't have the people, you can't get things done. Similarly, if you don't have money, you can't get things done. So investing in workforce development is key. In the Caribbean, our workforce development is so varied. There are some countries that may have, persons who are qualified, and then the disparity between qualified persons or the adequate amount of persons for surveillance lab, environmental health, and so on is so much less than what's available, what's happening in, let's say, the developed world. When you look at our data, for instance, you may have one chief medical officer that is really serving an entire country and for all different types of diseases. So the approach we have taken in terms of workforce development funded by the Pandemic Fund, it's really to build an integrated One Health approach to workforce development. So you're training not just in surveillance and lab or outbreak investigation and so on, but really building capacity, saying that this approach has to be a One Health approach from tracking that disease, whether it from the farm straight on to human infection, as well as giving them the necessary skill sets. So we have an important program called the Field Epidemiology Laboratory Training Program. So Pandemic Fund provides funding to allow for that program. It's like boots on the ground. And we are doing this for all our countries. And one size doesn't fit all, because you have a small country like Montserrat will have a total different, set of requirements for workforce as opposed to a Bahamas. We serve 26 countries. And so that's also the power of regionalization, being able to look at what are the different gaps and then be able to tailor-made the interventions. So we are boots on the ground, building that capacity across, as well as tailoring it for the countries as well as overall for the region.
Great, thank you for that. Jean, it strikes me that we have witnessed very strong leadership in Africa, both from heads of state and ministers, like Minister Denby here, when it comes to championing pandemic preparedness. What is driving that high-level commitment, and what message does it send, do you think, to the global community about Africa's role in strong health security and shaping health security?
Andrew, I think you don't want me to talk about head of state, huh? I want to stay in my position till the end of my term.
Then let's just talk about Minister Denby.
No. Please don't laugh, but I will tell you something. When you see head of state on TV, they are powerful, they are strong, they are talking loudly. When you see them in private, they are scared, especially when they are sick. They start to look for support everywhere. During COVID, when they saw we lost some head of state in Africa during COVID.
Yeah.
When they saw some of their peers dying, they said, what can we do? And they started to become so involved in the health area. Ministers of health, it's their job. They must be involved. Head of state is not their job on a daily basis. And they said, how can we champion an initiative that will help us, first, to remain alive, second, also to save the life of our people? Doing that, it's also benefiting the whole continent. But after COVID, we saw the interest in the health area going down. How, as African health leaders, we can maintain this momentum? We need not to speak the language of Minister of Finance, Minister of Economy. Now we are maintaining the momentum by talking about local manufacturing. How local manufacturing can become not only a public health, health security, but also a driver of the economic growth and job creation. Second, digital agenda and AI. How can we use that as the entry point to build a strong e-governance and to create resources? This is how we are managing to bring them back in the health area. Unfortunately, I was informed that for the next AU-EU summit, health was not part of the debate. We are managing to bring that back because they will not run away. Health will remain.
Nice. You keep them on it. Minister Denby, same question for you. Would you agree on Jean Kasseya's assessment of heads of state?
Hey, don't comment, please.
No, I think just for us in Sierra Leone, when we had the Ebola outbreak, everything stopped. So schools, people didn't go to schools. markets didn't open, ships didn't come in, flights didn't come in. So the devastating consequence of an outbreak of that nature is very sobering.
Yeah.
Yeah. So what we've done in Sierra Leone is to take that now and say, how do you prepare for the next one? And you prepare for the next one by ensuring that, by the way, just stepping back, when you have an outbreak, everybody gravitates towards the current outbreak. And what happens is all of your gains in maternal health, in child health, in malaria, all of those like fall apart. And for us, what we've done now is to say, how do you look at preparedness from the lens of strengthening institutions and strengthening public health to as close to the people using primary health care as the backbone? So when you have a very good primary health care system and you have early warning and triggers built into it, you're able to detect things quickly and respond to 10 measles cases than wait to respond to 1,000 cases. So what we've done is strengthen primary health care and use surge capacity in our primary health care to be able to quickly detect and respond to outbreaks.
That's great. And also, the best preparation is having a healthy populace and a good and strong health system, period. Thank you so much for that. Last question. We're out of time, but Minister Nasruddin, I just want to come back to you very quickly and ask just what are the top priorities that you would say are required for sustained investment rather, to ensure countries like Lebanon are not just reacting to emergencies, as the minister was just saying, but being truly prepared, detect, prevent, contain?
Well, from our experience in Lebanon, unfortunately, we've learned it the hard way.
Yeah.
What's more important than being prepared is to prevent the crisis from happening. But once you're there, you should activate your plans. As you know, we have encountered true drills. Usually when you prepare, you try to make fake drills and train the system, see the poor communication, check the gaps, and fill it accordingly. Whereas in Lebanon, we had to deal with true drills. From the port explosion, the famous port explosion where we encountered hundreds of casualties in front of emergencies, ending up by the latest war, the incident of pagers, the COVID vaccination, the COVID cases, and the other crises, including geopolitical problems. So I can now identify 3 gaps that all systems should try to fill when dealing with emergencies. One is basically governance, where you need a center at the high level. We name it in Lebanon FAOC, Public Health Emergency Operating Center, for governance and communication. You need to improve your communication between the center and the peripheries and the primary healthcare centers and the hospitals, and definitely the internal forces that are working. You need to check the data and plan your next step based on data and do your solid interventions accordingly. And then also, you need to do the proper networking and give the facilities that you need to deal with, such as I was mentioning before, the Central Public Health Lab, and proper assessments and evaluations done through critical and strong systems. So basically, I think the Lebanese model of dealing with things can be published, actually, because we had a lot of, unfortunately, sad events that we learned a lot from. And luckily, we were able to have this system not crashing because of the historical communication and skills that we have in Lebanon with the huge academic centers and institutions. I'm coming from an academic institution at the American University of Beirut with a huge background of history in terms of medical facility and health interventions, and this is the same applies for other centers, and this is what actually made us have this strong system initially, and despite all the challenges, we were able to stand with the elements that I spoke about. So again, more important than dealing with crisis is to prevent it from happening initially.
So thank you for sharing that example of resilience. And by the way, that's a common theme that I've heard in the entire panel from the experiences terrible experiences that are creating learnings that we are applying to enhance our protection as catalyzed by the pandemic fund. So please join me in thanking Minister Sadiqeen, Minister Nasser El-Din, Minister Dembi, Dr. Lisa Indar-Kins-Uleman, and Dr. Jen Kaseya for their excellent thoughts. Thank you so much. But we're not done yet, so don't go anywhere yet. You're not allowed to leave. Sit back down. Thank you. So, if I may, we're going to take a photo afterwards, if we would. Or you want to take a quick one? It's okay. Excellent. Thank you so much. Priya, please do stay with us. So, okay, great. So earlier this year, the Pandemic Fund launched. Hello, everyone. Earlier this year, the Pandemic Fund launched an exciting new initiative. It's External Advisory Council, EAC. It brings together, in addition to the civil society members of the board, this group brings together 20 leading organizations spanning the private sector, philanthropy, academia, and civil society, and they help to advance this evidence-based advocacy and strengthen pandemic response. And we have with us today two co-chairs of the EAC, Dr. Edem Adzogenu of Afro Champions and Tisha Wheeler from Roche Diagnostics, and several others are in the room as well. And thank you for all being here. And I'd like to invite Priya back up to have a chat with those EAC members and discuss with them, a fireside chat, a little bit about the progress they're making. Please, Priya.
So thank you very much, and welcome, Edem and Tisha. So maybe let's start with a broader reflection. The External Advisory Council was designed to bring together diverse partners, foundations, the private sector, philanthropies, academia, around a shared mission of making the world better prepared for future pandemics. From your perspective, why does this kind of collaboration matter right now? What gap does the EAC help fill in the broader global health landscape? Maybe let's hear from Tisha first and then from Edem.
Well, thanks a lot, Priya, and thank you for letting me be co-chair of the External Advisory Committee. I think it's a really rewarding opportunity for me personally and as Roche to represent diagnostics for pandemic response. I think if there's one thing we know in global health today, we can't tackle what's happening alone, and we certainly cannot look at it as one disease or one health system. We really need to work together. And through the EAC, I think there is a really unique opportunity to leverage this diverse coalition of members who can bring to the table different expertise, and we can focus finance, we can focus investment, and we can really see where that focused investment can pivot to strengthen pandemic preparedness and response. So I think we really do have all the right people at the table. And as we're looking at the challenges, we have a learning agenda that we're developing now. We're looking at these challenges and we're saying, how can we work across these areas together? How can we envision something different? And we all bring to the table something new, a new perspective from what happened before in previous pandemics, and I think a new energy. And I hope that that manifests really in these new strategies that we're seeing countries bring forth.
Excellent, thank you. Adam, your reflections on the same question.
Thank you, Priya, and I do agree with Tisha that what the EAC provides us is the opportunity to galvanize people that normally wouldn't have been involved in this space in a very unique way. We realized how fragmented and siloed we were as a global community when the pandemic struck. But at the same time, we saw how it unleashed efforts and support and contributions from diverse institutions, people, and capacities globally. It would be a wasted opportunity to allow all of that to disperse back, only to look at how we rearrange and regalvanize them again. So the EAC really has become that vanguard, in my opinion, and I'm also privileged to be its founding co-chair or initial co-chair, to sort of reach out to this very network, some in entrepreneurial networks, others in, of course, philanthropy, civil society, but governments, to sort of co-create, this mechanism around prevention, preparedness, and response in a very unique way. The real issue is really about not the ideas. There's not a lack of ideas, knowledge, information, capacities. It's how we work together. As a global community, we're good at doing things individually, but what EAC presents us is an opportunity to do it together.
No, that's great. I've really been impressed by the energy and dynamism and how quickly the EAC has sort of come together. And one of the things that's been most exciting, I think, is how you're already, as the External Advisory Council, helping to connect ideas, networks, and innovations across sectors. So we're seeing that happen. The private sector, in particular, has been investing heavily in preparedness and response, both preparedness and response long before the pandemic fund existed. So Tisha, maybe I can come to you on that. Roche was one of the first private sector organizations to join the EAC. How are companies like Roche already contributing to pandemic preparedness and innovation, and what kinds of partnerships do you think hold the most promise for scaling impact?
Yeah, I mean, what's interesting is, Roche is a company that's been, addressing healthcare challenges for 125 years. And I think that, looking at, what's going on today, as a diagnostics company, we're extremely ready to respond, especially when it comes to global health security. And, there are many ways that we can do that as the private sector. Roche happens to be the first company that developed an IVD test for COVID-19, for Zika, for Ebola, stood with several governments in the mpox response. The Africa operations of Roche, they're 900 people strong. We're present in 40 countries. We have an R&D site in Cape Town. We have a massive training center in Johannesburg and one in Cote d'Ivoire. And I think the global presence of companies like Roche really enables us to, partner with governments and really understand what is needed during an outbreak, because we're already there. But also, when you have boots on the ground already, you're ready to adapt and respond. And so I think that's a real benefit. And the partnership opportunity that I wanted to share is actually a sample transport pilot. Very sexy, right? Sample transport. But I think some of my colleagues from the ministries were talking about how critical this can be. So this is the National Integrated Specimen Referral Network that the government of Nigeria is actually leading with the Global Fund and companies like Roche to look at how to integrate and optimize testing across disease areas like HIV and TB. And what we're doing is we're looking at our existing infrastructure and how it can be used better. And so what they've done is they're looking at how do we create this national system? First, they have to attract the budgetary allocation. Then they have to upscale the cold chain. And then, we need to look into the operational dynamics of how those disease silos used to be managed and turn them on their head. And then what this does, it not only improves test efficiency, but it improves the ability to seek out and find those co-infections that people may be suffering from, and reduces their opportunity costs, because they shouldn't have to come to multiple places for multiple diagnosis. They should only come to one provider, right? And so overall, I think that what this does is it enables better disease surveillance, it enables better management overall, and then it really puts the onus in the hands back into the government to, as it rightly should be. And I think some of my colleagues up here just spoke about this. And so that's the type of project that we're supporting. And for sure, I think we heard also from Dr. Kaseya that this kind of an approach could be supported in every African country and be an improvement.
So maybe if I can ask a follow-up question, I mean, how do those kinds of partnerships complement what the Pandemic Fund is supporting? And where do you see opportunities to work more closely together through platforms like the EAC?
Well, I think, we all have an experience having lived through, the COVID-19 pandemic that kind of brings energy to this moment for us, right? I talked about, we had involvement with Mpox, we had involvement with COVID, we're involved with the government of Nigeria. And I think when you look at what we could do with the Pandemic Fund, or what diagnostics could do with the Pandemic Fund, really, it's testing infrastructure and innovation. And then it's also supply chain and capacity strengthening. And some of the ministers already spoke about this up here. And I mentioned before, in Africa, we have a pretty huge presence. That molecular instrumentation, which I mentioned, is capable of testing 32 million people a year. That's the same instrumentation that's used in Georgetown Hospital in Washington, D.C. It's used here, the same stuff that's testing for cervical cancer, for HIV. This could easily be pivoted for pandemic response, just with the right planning. And then I think the other thing is when you're talking about how can we also be really on the ground at point of care. If you have a high quality point of care instrumentation also in your network, it brings real horsepower to your entire pandemic response. And then finally, I think we were talking about the Caribbean. Being able to send out that capability to develop rapid development of assays is really important, because you might have a couple worrying cases on the ground. You need to see what those are, and then you need to be able to understand, is this a bigger problem, and then turn that capability into large-scale test capacity. And then finally, when it comes to the last 2 points on supply chain and capacity development, I mean, as the private sector, we can really leverage global operational networks, and we learned what went wrong before, right? We can look at those and we can say, how can we tackle those systemic logistical challenges? Mm-hmm. How can we address stockouts? And then with capacity strengthening, we have these training sites. We need them anyway to train people on our lab equipment, but we use these training sites. We've trained 9,000 lab providers across the lab directorates and all the staff of the African lab systems. Mm-hmm. We can easily think of a strategy, I think, with Dr. Kaseya on what is needed for pandemic response across Africa, and we could leverage our Francophone and our Anglophone training centers.
No, that's great, and I think the EAC's learning work stream in particular is helping to capture some of these lessons and best practices, and we look forward to working with you to translate all of this into action across regions. So thanks so much, Tisha. Turning now to Adam. So Adam, just building on that, your work with the Afro Champions has really focused on putting African governments and institutions in the lead on investment and policy priorities. We've seen that recently through the Accra Summit and then the Accra Reset in New York last month, both of which the Pandemic Fund was proud to be part of and support. So in your view, how can initiatives like the External Advisory Council reinforce those country-led and region-led efforts? And what's the opportunity here to align public and private investment better behind your national priorities rather than around separate agendas?
What we learned from the pandemic, and it's interesting you mentioned Afro Champions, because Afro Champions actually grew out of an epidemic. It grew out of the Ebola epidemic that Minister Dembi talked about, where we went and mobilized the African private sector and the African Union to work together to create a fund that raised about $39 million at the time, and were able to send doctors, paramedics to Liberia, Guinea, and Sierra Leone, and felt very proud to have brought some support to seeing the eradication of the epidemic. And then subsequent to that, thinking of how to keep that network together so we are not people we only go back to only when we need sponsorship, and immortalize it into an institution. And that's how Afro Champions grew. It grew from private sector contributors who came in and provided support to Ebola. But what were they championing? They were championing cross-border investments, all of which were imperiled by the disease. I mean, borders were closed, people could not move together. So once people cannot move, goods cannot move. So there was a need for private sector and businesses to see the need to build coalition with government to end this pandemic. And based on that, we supported the African Union towards the establishment of the Africa Centers for Disease Control, provided initial seed money, and consequently, when the pandemic came again, we were able to help the AU create the Epidemic Fund, which raised $100 million. So that's been our sort of competence and expertise in being able to look for champions wherever they are to co-champion a collective effort, and in this case, in the pandemic. So I'm a strong believer that that's the only way this would work, and I recall when the DG talked about the digital platform we built during the pandemic, we had to connect with the private sector ecosystem, but also the startup and SME ecosystem. And that's where we saw these innovations that existed, coordinated and brought it together, and in a matter of months, we were able to build a digital platform that connected over 7,000 labs on the continent on a common platform. Port health systems were integrated, national repositories, all the way to dashboards in the AU. And Minister Dembi, again, Sierra Leone played a very leadership role in that, in being one of the countries that adopted and used that platform. And for Africa to become actually the only country and continent with an interstate digital health platform during the pandemic and doing actual digital verification of COVID certificates and vaccines. CARFA was one of those under Dr. Didakus that brought the Caribbean to join that platform as well. So we felt extremely very proud. But what we saw again was that once you had health data, you had travel data, you had genomic data, you have test data, you have vaccine data, you have such an avalanche of information on how variants were moving across the continent. So a lot of the work that needs to continue is building these systems, digital infrastructure, the e-health backbone of the continent, not siloed again in 55 countries, because countries will be doing very well and will have their own systems. But once another country is not doing well and they have a pandemic, it's going to come back. So that's where Accra Reset really comes in to say, we have a lot of ideas and there's a lot of amazing things happening at many places, but how do we scale? How do we integrate deeper? How do we actually even know what's going on? Amazing things happening. And I think EAC sits in a very unique position to sort of absorb the collective strengths that exist and build the linkages necessary to enable companies that have massive capacities. I mean, the kind of capacity, Trisha talked about what they're doing in the area of diagnostics, but also in the area of things like supply chain management and things like that. The amount of resilience that companies that have infrastructure already in place in moving commodities across the continent, that capacity could contribute to moving vaccines and things like that on the continent. They just need to know how to fit in, and no other intergovernmental body with the kind of linkages like EAC would be able to do that. And many, many other works that are happening. I mean, we saw, again, during the pandemic, how the startup ecosystem were doing things as well as culturing soccer art and things like that, with the hope of creating, animal vaccines. Nobody even knows these things exist. But they could have, reached the vaccine even quicker because of the kind of agility under which they were working. But again, someone needs to flash the lights of them. So Accra Research's job is really to bring all these, or its expectation is to bring all these innovations within a lens where funding models can be built around them. Because we cannot have all these ideas under the expectation that there's some money sitting in a pot that will fund it. Otherwise we'll break the neck of the pandemic fund. I mean, we have to find ways of making some of what we're investing in already becomes drivers of growth and multiply money. So that's where, again, the initiative that was launched in Accra and also in New York is looking at bringing a broader ecosystem of financiers into the discussion to learn lessons of what is working and to see how we can scale that, but more importantly, recognizing that all of these things need to be, or can only be sustained through sustainable business models.
No, indeed. So we are a catalytic fund, as you know, and we've been quite successful in catalyzing additional resources from multilateral development banks as well as from domestic public sector. So I think our next challenge is to be also able to catalyze additional resources from private sector, both international and domestic, so around the needs of countries. So I think we'd love to do that. You started to answer the next question I had for you, but I just wanted you to maybe briefly tell us a little bit about, you've spoken in the past about the need for different kind of partnership, right? And we've been hearing about this all day today about, the need to reimagine partnerships. What gives you optimism that the External Advisory Council and the Pandemic Fund more broadly can help deliver that?
I think I'm a great believer in God's law, which is that all the complex, big things that happen successfully are components of little things that work very well. I think what gives me much confidence is that all the members or participation organizations of the Pandemic Fund are institutions that are doing amazing things on their own and are successful at what they're doing. What, like I said earlier, we haven't done well is because of the investment mandates, because of shareholders' mandates, because of board positions, we have our fiduciary responsibilities only to our organizations and institutions. This transmediary network we're developing to see, in spite of what we do successfully on our own in fragmentation and silos, how can we together as a collective work more effectively is a model we need to test. And I believe among the participation organizations, which you've been very selective in choosing, because I'm sure there were several others who would have liked to be this, we can prove you right and make it happen, and we will.
Excellent. So it's really inspiring to hear how both your organizations are thinking about partnership and innovation, not as side efforts, but really as core strategies for resilience. The External Advisory Council was created precisely for that purpose, to connect ideas, to elevate what works, and help countries and partners move faster together. So thank you very much, Tisha and Adam, for sharing your insights and for the leadership that you and your fellow External Advisory Council members are providing as we continue on this journey. And we really look forward to working with you as we scale up the Pandemic Fund. So thank you again.
Thank you. Thank you very much.
So actually, we do have one last. The event isn't over yet. We do have two interventions that we would like to share with you. Firstly, we have a short video intervention from Dr. Mebratu Masibo. He's the Chief of Staff of the Office of the Ministry of Health, Ethiopia, and he's joining us via video. So let's play the video from. Oh, he's virtual. He's connected live. So let's have Dr. Mabratu.
Thank you. Thank you so much for having me. And apologies, Her Excellency Dr. Magdas couldn't make today, but it's unfortunate we're not there. But I just want to reflect on the all discussions we had in this afternoon was very great for Ethiopia, and to reflect what Pandemic Fund is doing in Ethiopia in practice. So, you know, in Ethiopian EPPR Pandemic Fund project, we started with our JE assessment, which I think everyone knows that we did robust assessment and defined limited early warning systems on the digitization for alert of epidemics, pandemics, and the insufficiency on disease screening capacity, a shortage of skilled workforce to be deployed, as Mr. Dembe previously said, in some of African countries also, and also gaps in bioinformatics and the genomics, which we identified in era of COVID. And quickly, with key achievements in our intervention from since launch of this project, which we described, I think, in last year summit also, is strengthening surveillance and early warning system, especially at the point of entry, was a really great achievement so far in this project, that Ethiopia with its neighbors working very closely on point of entry. The second very important achievement we had is now we have 300 workforce who could be deployed anywhere, not only in Ethiopia, neighboring country, in Africa totally. So we already equipped them with the skills trainings. The third very important thing is our lab system is very capacitated. Thanks for the private sectors. Also, the main problem, especially in Africa, is reagents, supplies for the laboratories, detections. Our detection capability is very much strengthened. One simple example, for example, Ethiopia did MPOX investigation in country, did genomics in country, and shared the result through Africa CDC and the WHO system. That's also a great achievement we had. In the procurement of ambulances and ultrasounds, which are digitally enabled, that the primary healthcare workforce can use from the remote part of Ethiopia, is also part of this project achievement we can highlight in this 1 year interventions. Also, we are working in point of interest and the point of operation centers for public health emergencies. It strengthens through data, through real-time data collection, sharing, and the decision making. Other very important factor I want to mention for the team to share is in Ethiopia, the catalytic role Priya you mentioned is in practice. We have now 24 project partners officially working with us with MOU. These are different academias, international civil societies, the private sector, and the local CSOs also, and including all government actors in One Health, environmental, human, and animal actors all are with us. How we work this together? We have a fund management mechanisms collaborated with these structures. We have 3 structures: technical working group led by different ministries, like Ministry of Health leads one, Ministry of Agriculture leads another one, Environment leads another one, and AMR system is also leading another technical working group. So we have this technical working group in practice. They supplement the streaming committee. The streaming committee, which is led by me and co-chaired by the Chief of Staff of Ministry of Agriculture. So we are collaboratively working together. And the third line is joint coordination committee, which is led by the Minister of Health, and the co-chaired by the implementing entity, which is represented by WHO. So we have these structures functional and working with great due diligence. In the project management system, also we have a team inside the ministry and also in the project implementation unit. We didn't add redundancy because we embedded this in an integrated way with other project management unit that we had at the ministry. So lastly, I want to say a few points, how we can focus for the future enhancement of this project. You know, Pandemic Fund in Ethiopia is $130 million project. 50 million is contributed from the Pandemic Fund and other catalytically from other funds. But this is not enough. Ethiopia SPAR assessment, prioritized assessment, shown us we need $800 million per year to make a country pandemic prepared. So that we need to augment, we need to catalyze with others, and we need to work in the One Health framework, especially focusing on data sharing from animal health and environment to the health systems, expanding early warning coverage in point of entry, collaborating with other countries, collaborating through our Africa CDC and the WHO Afro to all countries in our areas and beyond. And finally, domestic financing mechanism is very important for us. So now we are trying to have a strategy to mobilize more resources for the future, and they may come back for collaboration with others. Thank you so much.
Thank you so much. Thank you so much, Dr. Mebratu, for sharing with us all the progress you've made on the Ethiopia project, and we're looking forward to deepening this collaboration over the coming years and seeing even more results. But congratulations on all that you've achieved, and thanks so much for taking the time to join us. So, just to thank everyone here for being with us today, and especially those who stayed on till the very end. We had a great discussion. The ministers provided great insights on how pandemic fund projects are supporting them. It was great to hear from our civil society representative. It's great to hear from the Africa CDC, and very encouraging to hear all the progress that the External Advisory Council is making to take forward our private sector and non-sovereign pillar forward. So thank you once again. Also thank you to Andrew, and thanks again to our wonderful Pandemic Fund Secretariat team for putting this together, and have a great afternoon. Thank you.